You just rightly put it that you have challenges because from the reports we're getting, some parents are being, reluctant as a result of fear. And you want to share with us these challenges you're contending with, because if vaccination is part of the broader perspective of universal health coverage, how do we achieve that going forward?
So immunization is not new. It's everywhere, and we're beginning to see different things even in the West. For Nigeria, our main concern is how to actually create intentional vaccine education for our populace. Beyond all of the jingles, beyond all of the billboards, we're looking at how we formally, properly engage communities using the structures that are there. We have very wide footprints in Nigeria across every settlement. You see one, maybe a health post or a primary healthcare center. It might be level 1 or level 2 or level 3, depending on the facility and the services that they provide. But another thing that we did see recently was the misinformation. Certain groups of people have decided it is their business to go about and misguide Nigerians and tell them all sorts of stories. We did see that from 2003 with the Kano incident of polio campaigns. We're able to resolve all of that. We've worked with the partners, we worked with the state, we worked with the religious and traditional leaders, we work with CBOs and CSOs to be able to correct some of these things. And yes, it's not all about misinformation, though. We have people who genuinely claim that they don't know about vaccinations and they don't know when. Then you have to look at all of it.
Do you doubt that?
I wouldn't really doubt that, but I would say that is a small fragment of the population.
Okay.
Yeah, and we have more people who are aware of it. However, have their reasons. Might be religious, might be social. Sometimes they're bigger. We just recently resolved the case in one of the states where we're conducting a polio campaign. We just concluded the polio campaigns where a whole community just turned us down. And by the time we got into them to engage with them, we found that their issues were different. They were talking about all of the bad roads, all of the other social factors. And yes, government is unwholesome. Whether we are the MPACD, we're still part of government. We do our part. We make sure we provide the vaccines. We make sure we train the health workers. We make sure the vaccines actually get to those last mile where it is important. The vaccines being in my store or the National Strategic Cold Store does not mean anything. I can come and say I have 50 million doses of any antigen. But so long as it doesn't get there, so that's what MPCD does, getting the vaccine to the people.